Hello guys, hope you're all okay, you're all enjoying your life, and welcome back to Dr. Arshad Nadeem Awan Ultrasound and Radiology teaching video. As you all know that I'm on the course of discussing kidney, ureter and bladder. So today my topic is related to pediatric nephrology. So that is called as neuroblastoma. Neuroblastoma is a very common tumor, especially seen in the children's less than 8 years of age, but mean age is 3 years, and the patient presents with the abdominal distension, abdominal pain and some neurological symptoms. You can find this tumor particularly on the renal adrenal glands, but it can occur anywhere along the sympathetic nervous system. So far ultrasonic features of neuroblastoma is concerned, it happens to be hypoequic, and the second commonest characteristic feature of the neuroblastoma is that it encases the surrounding vessels. So contrary to the Wilms tumor or neuroblastoma, which only pushes the vascular system. So on the grounds of these two, you can distinguish between the neuroblastoma and the nephroblastoma, as neuroblastoma encases the large vessels or whatever the vessels comes in his way. So this is what neuroblastoma is, how it will appear on the ultrasound imaging, how we will recognize it on the CT, what are the main role of the nuclear medicines or nuclear scintigraphy. All this will be included in this video. Let's start watching these images.
On this ultrasound imaging, you can appreciate that the kidney is entirely obliterated. There is no parenchymal identifications of the kidney because of a well-defined hypoequic, rather I would say here it seems to be slightly heterogeneous solid mass. So there is no outline of the kidney visible. So this is a severe case of neuroblastoma in the children with the age of 3 years. Another example of the ultrasounds for the understanding of the neuroblastoma. Here on this image you can appreciate a well-defined hypoequic round mass within the kidney. It's almost occupying the entire kidney. This is how the neuroblastoma will appear on the ultrasound imaging. There is no cystic degenerative changes within it. There is no calcification visible. It is purely solid hypoequic mass occupying the kidney. It is the right kidney, and here you can appreciate a well-defined hypoequic solid mass involving the upper pole of the right kidney. And here just correction, it is the left sided kidney, and here you can appreciate the upper pole of the left kidney showing a well-defined hypoequic mass with the vascularity. Sometime this mass enlarged enough to cross the midline, and beside this it also encases the surrounding vessels as well. Another example of the neuroblastoma, and in this neuroblastoma there is clearly visible hypoequic solid mass, although a slight heterogeneity can be seen. So for the renal parenchyma is concerned, you cannot clearly see the renal parenchyma. It has been obliterated by the neuroblastoma. Another clear example of the right kidney, and on this right kidney you can appreciate that there is a large hypoequic solid mass arising from the upper pole of the right kidney, and which is almost pushing the liver aside, and it's also crossing the midline. So if it goes forward, upward and backward, it will encase the abdominal vasculature structures or other structures. Another clear example of the neuroblastoma, here you can see part of the kidney is visible to you, while inferior part or inferior portion in this image you can see it's been occupied by the neuroblastoma, and it's coming inferiorly downward. Eventually it will encase the abdominal vasculature, and so far the lesion is concerned and mass is concerned, you can see it's slightly hyperequic, but there is no cystic degenerative changes within it. You can see this neuroblastoma in the developing fetus. Here you can see this is the antenatal scan, and within the fetal area you can see the kidney, and kidney is developing a lesion that is actually neuroblastoma, and neuroblastoma is able to metastatize to the placenta as well. So this is one of the hallmark of the neuroblastoma, and this is the tumor which is particularly seen in the pediatrics age group. Here is another example of the fetal neuroblastoma. Always pay attention to the fetal all organs, liver, spleen, kidneys, heart. These are very important areas, because when there is heart drops you can see the fluid. When there is ascites, then there is pleural effusion, you can clearly see. So far this scan is concerned, in this you can see that the fetal kidney is occupied by the neuroblastoma, which is clearly visible on this image. Another example of the fetal neuroblastoma, here you can appreciate that the kidney shows some obliterations with having an echogenic lesion arising within the kidney. So this is how it will look on the antenatal scan.